Your name is Karen.
Hi, my name is Karen.
Hi, my name is Shanice.
My name is Jeanette.
Brian.
I don't want to be on
Brian.
Brandon.
Deezy.
I'm Adriana. This is my persuasive speech about alternative medicine. So here I go. How do you go about things when you find out you're sick or when you're dealing with discomfort or stress? You may go and see your doctor right away or pop some antidepressants from time to time. Well, then you're not alone in your search for the magic pill that will take all your anxieties or painful symptoms of general malnutrition away. People who suffer from many different diseases like diabetes, cancer, and drug addiction and depression can benefit from not always going the traditional route every time. One thing we fail to remember when things get rough is that we're equipped naturally with ways to fight off disease, illness, and aggravating symptoms caused by stress. Ways you can prevent these things are plentiful. However, in this speech, I'll just be reviewing just a few of your options as far as alternative and complementary treatments is concerned. Using alternative methods may seem a bit sketchy, right? I mean, what are they anyways? Well, here's a dictionary definition for you. Alternative medicine is an extensive range of medicine that's been unrecognized by the medical profession and is viewed as unorthodox. Although it isn't recognized in the medical industry as a conventional method, alternative medicine has proven itself to be effective if it's done correctly. And studies show that 1 in 3 Americans use some form of alternative medicines like yoga, acupuncture, tai chi, and other dietary supplements to improve the immune system and heart health. Like I mentioned earlier, there are literally plenty of benefits to resorting to alternative medicine. And when you open to your mind to the subdivision of medicine, you can pretty much choose in a way which medicine or remedy would be right for you. Meditation, yoga, and acupuncture are among some of the most popular methods of alternative medicine being used in America today. Those are the ones I'm going to be going over a little in my speech. Growing evidence indicates that many alternative methods may be used safely along with other standard ones. For example, clinical trials suggest that mind-body methods like meditation can suppress stress and ease the pain of medical procedures. And Dr. Mary E. Charleston indicates that studies have proven that acupuncture can significantly reduce nausea and vomiting connected with chemotherapy. Meditation is also one of the more popular methods of alternative medicine. It's been proven to reduce stress, level your blood pressure, and also give an all-around sense of well-being. And stress may feel like it's just purely emotional, but it's definitely got its real physical implications. And one result that affects the heart has to do with high blood pressure. When the brain releases cortisol, which is the stress hormone, the heart tenses up, it reduces the amount of space available for blood flow, and this raises blood pressure, which can ultimately damage the heart's arteries. Also, studies that have been conducted by the National Center of Complementary and Alternative Medicine has proposed that systematic mindful training and other meditative practices influence the brain involved with improving your awareness, attention, and your emotions. Also, in a study in February 2006, a women's study was also conducted by the NCCAM, and it concluded that meditative patients were less anxious and depressed and more optimistic that their breast cancers would improve fatal. And we all know someone who's been affected somehow by depression or stress-induced illnesses. And we've all seen those commercials where some new pharmaceutical drugs being promoted. And I'm sure we've all noticed at the end of the commercials too, where some speaker just rushes through all the negative side effects that these clinically approved medicines can maybe cause. They're going a mile a minute, and we could barely hear them say things like, "Don't take this if you have heart problems," or "This may cause swelling of the throat," or "suicidal thoughts," and etc. And I know I'm not the only one who thinks, damn, why even take them in the first place if they're gonna, do more harm than good? And according to Dr. Charleston, these clinical antidepressant drugs are only effective for a short period of time. And after a while of taking the same prescription, your body sort of grows out of it in a way. And after so long, the person starts to demand new drugs or a different element than the previous one could provide. And this just turns into a cycle. You chase another drug after another, trying to numb the same symptoms you had to begin with, and some from taking the other drugs. And you know, you shouldn't have taken the prescriptions in the first place. And I think it's a little ironic how conventional medicine's origin is what we now call alternative medicine, because acupuncture is classified by conventional wisdom as alternative, but in fact it's been a proven method of treatment for over 5,000 years. But here's the simple truth. We all know what it's all about. It's about money. Alternative medicine has exceeded over-the-counter sales of conventional meds for over several years, and alternative medicine should have its place in the patient care. But except greed has replaced the real concern for patients in the pharmaceutical industry. And when I was thinking about the speech, I remember reading a forum and someone said, alternative medicine is only alternative because it doesn't work, and if it did, it wouldn't be alternative. But I've come to the conclusion that to prove or disprove any alternative therapy has no cost benefit for the pharmaceutical industry, because most of them can't be patented. And the rationale that conventional medicine should be the only choice is what's driving healthcare reform. And all the people really want is less expensive treatments that work. So if you're listening to this and you know someone dealing with depression, heart regulation, or maybe even having trouble coping with life's difficulties, suggest alternative methods of treatment. If nothing else would work for them, maybe something like this would. So when, you know, pretty much alternative medicine is good for you, and it promotes the general well-being. So thank you for listening. I hope I helped you or someone you know who's going through some tough times.